pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. May I have a roll call of supervisors, please? Thank you. Supervisor Gable, O'Day, and Alverman are excused. Moving on, right now we are going to have the Kenosha County Opioid Task Force presentation by Patty Hall and Debbie Ruber. If you could please come up to the podium. Thank you. I will allow questions after the presentation.
Well, thank you for having us here tonight. I am the co-chair, and Patty Hall is the other co-chair, and she's here. So if you have questions for either one of us afterwards, we'd be happy to answer them for you. So I'm here to represent the Kenosha County Opioid Task Force. We've been in existence since February 14th of 2017. This was an idea that Patty had after speaking with Lake County, and they had an opioid initiative going on. So she went to our human services director and said, is this something we can do? And he said, absolutely, let's give it a try. So we brought together a group of people that are very interested in this subject. I don't think you can turn on the news or open the newspaper, go on social media and not hear about it. But this is funded also by a CARE grant. It's also known as a co-op grant, which is Comprehensive Opioid Abuse Program. And this allows us to meet on a monthly basis, allows me to oversee this initiative and give some staff time to it to be able to draw the people in, make sure things are together for this grant. There's lots of different agencies that are involved. Law enforcement is big with it. We have EMS on board, the hospitals. We have people in recovery that are helping guide us as well, and also have lots of different providers and agencies that are involved in this initiative. We have 5 different work groups that work as a part of this task force, and they meet separately. And it's generally people that are involved in the task force, but it also is outside people that might not come to the task force meetings. So we have the healthcare and first responder team, the legislative and policy team, treatment and recovery data, as well as the prevention, education, and awareness team. And they have different initiatives that they're working on to bring back to the large group and report on how they're moving things forward. So during our meetings, we do a presentation. Generally, we invite somebody to come in and educate us a little bit on what's going on. And it helps just bring everybody together under one roof, because a lot of us are doing great things in the community, but we don't always know what each other is doing. So this gives us a chance to share that information and then pool our resources, as well as work together to get it done, because sometimes if you're working solo, it doesn't get done as easily. So we've had a lot of great accomplishments. When we first met, our very first meeting, we were allowed to have, we were fortunate to have Sheriff Beth there, and then the health department was also there at the same time, and they were saying, well, it would really be nice to carry Narcan. And the health department happened to have a grant to be able to provide Narcan. So that was one thing that stands out as from the start that it happened. Then we also have created some packets, and that's something that we handed out to you, and I'll explain that in just a minute. There's a card that if you see something, do something, that EMS has helped us put together, and what they did was help us get it out into the community as well. What EMS is seeing is a lot of times there's overdoses in parking lots or in public bathrooms, and they wanted owners of the businesses to be able to do something. And so this card was given out during inspections and encouraged people to call and get their staff members trained so that they could be kind of a first line of defense. We also have the peer support specialists that work through Kenosha Human Development Services as part of this grant to work with EMS and be able to get referrals, because a lot of the overdoses that are happening, people might want help, but they might not know where to get it. And the peer support specialists are people that have gone through addiction. They are currently in long-term recovery and can meet people where they're at as far as knowing what services are available and hooking them up with that service. Because sometimes people don't know where to go. A lot of times people are like, oh, it's as simple as a phone call, but it's not always easy to make that phone call. So that's been very well received. We also have a Facebook page that has really helped increase our visibility out in the community, and I'll explain that in just a little bit. As far as our overdose deaths, overall overdose deaths, the opioid deaths, as well as the fentanyl deaths, all of those have gone down from 2017 to 2018. Well, you might have been reading the newspaper lately, and you might say, well, what's really going on? There are a lot of overdoses happening, but out of the massive amount of overdoses that we just had in the last month, we've had 4 that have actually died. So I think we're doing something right. We have to do a lot more right, but we're working on those type of things. What else is going on in the community? As I mentioned, Narcan. That is not part of the opioid task force as far as getting people to do that. We help hook them up with the health department and get that training, as well as the AIDS Resource Center. We also have the MAT program, which is medication-assisted treatment, that the health department also does, as well as other agencies. We just had Clean Slate come into town, and then there's a new one that's going to be opening up called West Grove. They will be on 75th Street, so there are other medication-assisted treatment coming in and being able to help with that. We also have the diversion grant through the DA's office, and then we are also working with EMS to try to develop some heat maps to find out where overdoses are occurring. So we have some target areas, and we've done some target marketing through the health department to find where those places are where the overdoses are occurring, so that we could target Narcan training and some other educational sessions there. As I mentioned, our Facebook page, we had a recent post. It was an overdose alert that we put out, and we had just under 29,000 reaches with that, which is unbelievable. As far as, I mean, we've gotten maybe 1,000 here and there. This has increased the people that like our page. We've had 124 increase in the last month as far as people following us, and as far as getting that information out there, a lot of people are sharing that information. They're interested in it, and they want to know more about it. So if you're interested in finding out what we do, I know that some of you have attended our meetings and are always welcome to do so. Our next meeting is June 11th, and we meet at the Job Center, and we meet in North 2 from 10 to 11:30. This meeting, we're going to be talking about the overdose increase that we just had. We're going to have law enforcement talk a little bit about what they're seeing. We're going to have our peer supports talk about what they are doing as far as in response to that, how many they've got referred, how many they've got hooked up with services, how many that they're still trying to connect with. We also have some data that we're going to be looking at. So it's a great one to come and see and get a kind of a piece of the puzzle as far as what we're looking at doing. In the future, we also have other meetings planned that we are going to have other community members come and speak. So again, it's the second Tuesday of the month. And if anybody would like to be added to our email list, you're welcome to do that. It doesn't require you to come. Any questions at this time?
Yeah, Supervisor Gens.
Thank you, Mr. Chairman. And I thank you for coming in and making this presentation. I asked for this a few months ago, and I'm glad to see that you came in. This was a very quick shotgun of what I guess the background of the organization, but I'm trying to figure out what we're really doing in the big picture. You know, I'm looking at, I didn't hear us talking to schools, parents, that type of thing. I just, you know, I'm not sure what we're really, I understood the things with the EMS, and you mentioned Narcan about 15 times. I love that program, but that's a last resort. We got to work on prevention. And so I just wanted to hear, you know, your response on that. The Facebook, social media, you know, that many hits. I'm not technologically advanced, as this whole board knows, but I think that's good. And I think that the more people you could get to get into that, the better. What does the grant funding go for? What are we trying to do with that? What is the money being spent on? That you know, there's different teams doing different things. Do they go out and do their thing, and then do they meet monthly and then report to you, the main body? I mean, I'm just looking for a little more big picture.
Okay. So as far as the schools, they are invited to come to our meeting, but they don't always participate. They are doing a little bit of their own thing. We've asked for Narcan to be put into schools as far as, you know, obviously a second line of defense. But health classes have their certain curriculum. We have the prevention, education, and awareness group that is trying to meet and figure out where there are some evidence-based strategies to be able to use in our community. And I think there's a lot that's put on the schools, and that's not the population that we're seeing that is overdosing. It's a lot of times it's middle-aged, it's more men than women, but it's not only men. And what we're seeing is a lot of times people are using prescription drugs and then moving to street drugs. So I think what we've also looked at is education with pharmacies and trying to get them to educate people a little bit more. If you have an opioid prescription, make sure that you get Narcan along with it as well. You mentioned about the work groups, and the funding basically goes to help fund my position, part of it, and then the other part of it is to fund the peer support specialist to be able to meet with people after an overdose, but they're also working with people that are just interested in not using anymore. So what the work groups do is they meet either monthly or bi-monthly, and they come up with ideas of what they figure out would work for our community as things that we've identified in the larger group, or have certain agency that maybe is working on something, they help to further that along a little bit.
And that's great. That gives me a little more of an idea. Are there seminars we can put on? You mentioned pharmacists. I love that idea. Everybody goes to school, I would assume, at one time, so it's not a problem to start at schools and give them an idea. But I mean, are there seminars we can put on for different, you know?
We talked about developing a Drug 101 class. Because I think a lot of people aren't even educated on what drugs are. So if I said you could go to Narcotics Anonymous, would you know what drugs that is? You know, a lot of people won't. They won't know, well, is an opioid a narcotic, or is this benzo in that same classification? So I think it's even educating people in general on what drugs are. And I'm not saying how to use them, but we need to know what the different things are and what different things are out there. Also, even I think questioning doctors is okay to do and say, do I really need this opioid prescribed to me? Because sometimes when things happen, it would be something such as a oral surgery, so for wisdom teeth. My daughter had surgery a couple of years ago, and they gave her liquid opioids, basically. And I was like, does she really need to take those? And I'm like, I don't think that's gonna work out. Let's try doing something else instead. And being able to ask those questions, but I think you have to have the education in order to be able to do that. So that's where the Drugs 101 class could come in.
Thank you.
Anything else, Supervisor Gantz?
No, thank you, sir.
Thank you. Supervisor Berg, you have the floor.
Thank you, Debbie. I know you've done a lot for the task force. I've been to a few of the meetings, and I appreciate what you do. One of the questions I have is, of the opioid users or opioid abusers, what percentage of them have also a mental health diagnosis?
I don't know the exact number, but my guess would be
fairly high.
Fairly high, yes.
Number that I heard is 80% of substance abuses, period, is 80% of them have mental health diagnosis. So is there a way to do maybe even a joint task force with or a joint initiative with the mental health initiative or mental health coalition to do some sort of initiative to attract or persuade our hospital system or another organization to bring us more beds, more mental health, or behavioral health, I should say?
Well, seeing that I'm on both of those and co-chair both, I think that's something we can definitely discuss further, but you know, I can't speak for the hospitals as far as if they would be more open to that or not, but we can definitely keep that in mind as we move forward.
Appreciate it.
Anything else, Supervisor Burke?
Thank you.
I got a question, Debbie. How invested are the hospitals in this? Do they have representation? Are they there at your meetings? I mean, these people are getting opioids somewhere, and they're getting them prescribed from doctors, from hospitals. I mean, obviously, are they aware of? I'm sure they're aware of the situation, but do they basically have boots on the ground, so to speak? I mean, that's my question.
That is a great question, and we do have ER representation, so we have nurses that come from both ERs and participate in the task force. We recently just did Narcan training at Aurora, and they're going to be able to distribute there. As far as Freighter South, they have a meeting with our peer support specialist actually tomorrow. No, I'm sorry, Thursday. It is tomorrow, Wednesday and Thursday, so that they learn a little bit more about what peer support is and how they can refer. Because again, sometimes people coming into the ER, the problem is that we're hearing is people don't want to go through withdrawal. You're not going to die from withdrawal if you go through an opioid withdrawal, but it's very uncomfortable. So we worked with the hospitals to try to get them to know a little bit more about buprenorphine, and we had a doctor come down and speak in regards to knowing a little bit more about getting that information. And we had very poor attendance in regards to that. I think we had maybe 8 people out of the hospital systems, as well as Kenosha Community Health Center. So there needs to be a little bit more in the hospitals, I think, as far as buy-in goes. But they are interested and have been very supportive in the efforts that we've had so far. They do give out these packets. They're willing to call crisis and try to get people hooked up with services. And as I just alluded to, the packets, those are the information that we give out with EMS. Law enforcement gives them out. They're in the lobby of the safety building. They give them out in the ERs, anywhere that we possibly can to help people get the help that they need.
Thank you. Supervisor Decker, you have the floor.
Thank you. You mentioned about the schools that they have their own health curriculum and that not necessarily that it's getting into the schools. Wondering if that is teaching about opioids as part of the DARE program.
I am not aware if it is or not.
Okay, is that something that we should look into? Because you stated that middle-aged men and women, but mostly men, are the ones that are overdosing. Those middle-aged people tend to have kids in school, so if we can talk to their kids through the DARE program, it might help identify some parents that are facing these addictions.
Sure.
And then I went to the Narcan training last year, I believe, wondering how long a box of Narcan is good for if you keep it temperature, not that it gets overheated or anything like that.
It's generally good for about 18 months, and there is an expiration date on the bottom of the box. So does it expire the day that the expiration date is? Not necessarily, but they do recommend you replacing it after 18 months from that, or once the expiration date expires, that you should replace it. And you can do that at the health department or AIDS Resource Center.
Okay, thank you.
You're welcome.
Thank you, Supervisor Decker. Supervisor Nordigan, you have the floor.
Thank you, Mr. Chairman. My question is on the opioid abusers and those who have maybe gone through an overdose and survived it. Do they have a tendency to repeat? I mean, do we see more and more of the same people going through the program, I guess? Or any abuser, maybe?
As far as the overdoses, I think it's all very individual. As far as if one overdose and that's going to make a person stop, I think it just depends on where, what's going to change their mind to say, you know what, I don't want to do this anymore. Because obviously, an addiction is a brain disease, so it's something that they have to get help for. I would say sometimes we have people that are overdosing one time and they get help. Some people overdose, 8 times and
Okay.
so it's a variety of different.
Okay, thank you.
Anything else?
No, thank you.
Thank you. Supervisor Sklitsky, you have the floor.
Thank you, Mr. Chair. You're doing very nice work. I see from your own statistics here, 11 of them are fentanyl-based, 35 are opioid. I'm assuming mixed within there is both prescription and illegal heroin combined?
Patty, you want to take that one? These are her statistics, and I like to give her the floor.
Hi, I'm Patty Hall. I'm the medical examiner here for Kenosha County. For most of the toxicity overdoses that we see, they are mixed drugs. It's not usually just by itself. It's not usually fentanyl by itself. It's not usually cocaine by itself, or even Tylenol by itself, or oxycodone by itself. It's usually a mixture of different medication, or different drugs, I should say. So sometimes we see fentanyl with heroin, we see fentanyl with cocaine, but we also see Xanax, which is a benzodiazepine, which is an anti-anxiety medication. We see that. That comes up a lot too. We see marijuana also in there, coming up in the toxicity reports that we receive back. And, we do see the prescriptions in there too. So it's usually mixed. It's usually not just one certain medication on board. It's usually several.
Okay. And I see from your list of participants, law enforcement is certainly a part of that. One of the things that I think is a strong deterrent is cutting off sources, right? Now I know, and you maybe experienced it with your daughter, you had mentioned my wife had some surgery or whatever, and the amount of opioids that were being prescribed versus, say, 3 to 5 years ago is tremendously decreased, which is very good, right? And you can elect just not to even take them. However, there's still that illegal market. Have you guys been working not only just with law enforcement, but more importantly, judges and in the DA's office to start penalizing the sources? Okay, and I don't mean the kids that's raiding their parents' medicine cabinet. I'm talking on the street dealers, because they're the ones that prey on our residents, and they are predators. Have you seen or can you maybe give us some insights on a willingness from not just law enforcement, but from the judiciary side of things to penalize these individuals, to start helping that become a deterrent, not just Narcan in my glove box?
And I can't speak for law enforcement or the judiciary side, but both the DA is very active in the task force, and we also have KDOG represented, so that's the Kenosha County Drug Gang Unit. So it's important, or gang, I just said gang, drug enforcement, basically that they're doing. So they are going to report on that on Tuesday as far as what they're doing. It's not going to be like, hey, this is how we're doing it, or that type of thing, but give us a little bit of update, because we've asked that, because a lot of times people say, well, what are you really doing in our community? Right. And law enforcement, I think they have to be very careful about how they do it, because sometimes they're doing it very slowly and making sure that they have all their I's dotted, T's crossed, and they're very interested in obviously getting to the people that are dealing, and not necessarily the small-time people. It's not the everyday people, it's more of the drugs that are coming from Chicago into here that are coming out of Mexico. So
correct. Okay, because there's 2 prongs to this. One is you working more with the victim side, but we've got to have a willing law enforcement side of things also. to really start stemming the tide in this. Now, do you get a sense from your activities over the last year and a half, 2 years, there's any kind of improvement? I mean, I see from 2017, the numbers are down. However, you're a little bit closer to it than any of us. Are we having a positive impact?
I think we are, as far as people being more willing to talk about it, more people willing to ask for help, and just even the collaboration and the projects that we're doing, I think, are very important. Could there be more? Absolutely.
Yeah.
I think as people get comfortable as far as who can I trust and who can't I, that will help us build those bridges a little bit more. And with having peer support on board, I think is a huge factor, because they've been there, they've done it, and they can walk somebody through it much better than me, who read a book and has gone to college and hasn't experienced that. It makes a big difference that way. Patty, I don't know if you want to comment on that as well.
I do. So, as a medical examiner's office, we determine the cause and manner of death, but we do not have any part of bringing charges against people. But what I have been doing over the past few years is open up the communication lines with the DA's office, and also with the DEA out of both the Chicago and Milwaukee offices. So whenever we have a suspected overdose, I have my email groups. So one of the email groups that includes the DA's office, so that they know what's going on, that this is not a confirmed, but it's a suspected drug overdose. We're thinking that this is a suspected drug overdose. So they're included. I also include our SDART group, which is the self-harm death analysis review team that we have through Kenosha County, that we review the deaths. The same information of a suspected overdose also goes to KDOG, which is the Kenosha Drug Operations group. And then it also goes to, I have contacts at both the Milwaukee and the Chicago offices for the DEA, and that information also goes to them too. And then as soon as I know that that death is due to an overdose, is confirmed, then I send those same people the official reports that this is an overdose. So it kind of, we're trying to help them get ahead of things. Okay. So we're doing that on our part at the medical examiner's office.
Now, I guess from my perspective, law enforcement individuals do not need an education about street drug use because they see it every day. Do you think I'm looking at what the judges, are they up to speed enough? Do they see enough coming through their courts? Or is that something kind of like what was mentioned by Supervisor Decker of doing a 101 at the school level, making sure the judges are up to speed on how harmful this is to our society, or in general, do you kind of get a sense that they're in tune with what's going on? Because you hate to see a revolving door of a slap on the wrist, because they're right back at it, and it's a self-fulfilling prophecy that you don't stem the tide of this thing.
I think Judge Meyer has a great perspective on it, because obviously doing treatment court, but I can't speak for the other ones. She's the only one that I'm real familiar with, and I know Miliskowskis, I think, did it before she did. So I would feel very confident that they have a good education. I think we all could use more education. I know law enforcement gets a lot, but then they can also be specialized too as a DRE, as a drug recognition expert, and get a little more training in regards to that. And we only have a few here in Kenosha County, but again, the KDOG group is very well educated, and I'm sure they share. We've had, one of the police officers come and talk to us about clandestine labs too for meth production, and that has been helpful too. So I think that's a group we can reach out to and just ask if there's more needed. So
Okay.
I appreciate that suggestion.
Thank you for your work. Thank you, Mr. Chair.
Thank you, Supervisor Skalitsky. Supervisor Wamble, you have the floor.
Thank you, Mr. Chair. Thank you, Debbie, for being here. I appreciate it very much. I want to follow up on a couple of things, what Supervisor Berg and Chairman Esposito had talked about earlier when we opened this up for questions. You said that nurses do attend some of your meetings, or most of your meetings, correct? What about hospital administrators? No.
No, they do not.
Ever?
No.
Okay. Any reason why I don't know, I'm asking you to speculate.
I don't know that we have necessarily invited the right people. I don't know, we definitely can reach out and see if they're
I
interested.
think that might be a good idea. Also, I want to follow up a little bit on what Supervisor Decker said, reference the DARE program. Of course, in my world, we have the officer-friendly program. Do you supply them with any type of information to educate the grade school kids?
We haven't.
And do you think that's a good idea to go to the grade school level versus high schools where you have the health programs?
I think that would be a great source to go to because we want to build up resiliency, obviously, as young as possible. And then we can definitely reach out to them. I know that the issue has been, a lot of times, is with the Board of Education. They have to approve a lot of the different things that go into the schools. So that has been a barrier as far as getting anything, because I know that Hope Council has tried before to get in, and it's been mentioned, but we haven't, I guess, taken it to that next level.
So I think that would be at least worth pursuing.
Absolutely.
At those levels. And then lastly, have either of you seen carfentanil coming in? You have any cases of that?
No. I have, we have a lot of different analogs of fentanyl that we have seen, acetylfentanyl, phenylfentanyl, phenylfentanyl. Like, there's all these different fentanyls that we see, but we have not seen the carfentanil.
Okay, right. And that's extremely potent. That's why I'm asking if it's come up. So, okay, thank you.
That's it? All right, thank you, Supervisor Wambolt. Supervisor Gray, do you have the floor?
Thank you, Mr. Chairman, and again, thank you for coming before us this evening. Just in terms of the whole Narcan proposition, would you say that that's a fairly good metric as to assessing the need that's out there or the prevalence, the amount of Narcan that's administered in a particular, month, year, quarter? Is that a very good indicator?
So you're asking if the amount that we're giving out in Narcan, is that a good indicator of how much of a problem we have?
Yes.
I would say it's helping people get prepared. A lot of times what we did at the first round was try to get anybody to carry Narcan, because you never know when you're going to run into somebody that has overdosed. And now I think we're going to focus a little bit more on people that are actively using or have an active user in their family, and try to pare it down just a little bit more that way. We also have made sure law enforcement has received it as well. So I think it's a good indication that there is an issue here. We've seen it obviously with the overdoses that are happening. We don't always know where the Narcan comes from, so sometimes it's from us, sometimes it's AIDS Resource Center, sometimes you can walk into a pharmacy and ask for it without having a prescription, because we have a statewide standing order, and if a pharmacy chooses to participate in that, you can walk in and get that. But I know that there's a myth out there that says, people are gonna do more of the opioids because Narcan's available. You go into withdrawal immediately after you're given Narcan, so there's no benefit for them to, overdose. Like some people are like, oh, they're gonna do that just so they can get Narcan to get back. You're not gonna do that on purpose, because Narcan is gonna make you very sick because of the withdrawal symptoms.
Okay, but there's not really a metric out there as to, if you had so much Narcan usage, you could project that there's so much of a problem or so much usage out there. What you're saying is you don't have data available for that, is that correct? There's not a direct correlation?
Correct.
Okay. In terms of just raw numbers, if we're looking at Kenosha County or City of Kenosha, do we have statistics saying how many doses of Narcan have been administered in the last time period, the last quarter, 6 months? Do we have that type of data?
We do get EMS data. The problem is, though, sometimes it's administered and it wasn't an overdose, and there's not a way to, I guess, distinguish those out. Sometimes Narcan is given in the hospital setting as well, and it's not for an overdose. So it's hard to filter those out. We know that we have given, we've gotten reports back from the community that's been 11 different doses that we've given that they've reported back to us, but EMS reports several times that they get to the scene and Narcan has already been administered. But again, a lot of times they are still administering when they come upon a scene as well.
So there's really, to answer the question, not a good centralized methodology for establishing how much Narcan in a geographic area has been given out at a particular time. We have our hands around that, or we don't have our hands around that?
We have the amount that we've given out through the health department.
Okay.
But how much has been used, we don't have that. And then we don't know all the other avenues. So there is not one database that's collecting this information.
Which I think would be incumbent upon all of us here to try to get our minds around statistically is, well, you can say how much is given up, but how much is actually utilized. I mean, if there's some way of gathering that, I mean, I think it's a big metric, and I don't know how to address that, but I would hope at some point in the future we could come to terms with that. Just in relative cost, do you have an idea of per unit dose what the cost is to the entity who's supplying it? If it's not donated, what's the price associated with it? Do you have an idea on that?
So if you were to get Narcan from a pharmacy, I believe it's anywhere from $130 to $160, and that's for a 2-dose pack, and that's a nasal spray. As far as what we get it for is a lot less when we buy it through the grant.
Okay. So it's $130 to $160 for a 2-dose pack?
Correct.
Okay.
And that's if you have insurance,
Right.
private insurance. If you have medical assistance, I think it's a cheaper copay.
Right, but that, again, that's not a very realistic price because there's more things in action than just that list price for the drug, for the medication. Is that right?
So a lot of times, then that's why they can get it through, the Health Department AIDS Resource Center for free. So, because the grant provides that.
Very good. Thank you, Mr. Chairman.
Thank you, Supervisor Grady. I will make sure that I reach out to Sheriff Beth and Chief Miskinnis on some information in regards to the DARE program and officer friendly and our county representation in the schools, and I'll report back to the county board in regards to that. I'm going to clear the board. Any other supervisors have any questions for Patty or Debbie at this time? What time is that meeting? It is from 10 to 11:30. I walk in 20 minutes late. You're still welcome. Okay, and what I'd like to see, John, I don't know if we could do this, I would like a quarterly update from this opioid task force presented to the county board via email. We don't do that now. You can give Supervisor Gentz his in paper form, or he can come. He doesn't live far from your office. He won't get it via email because he won't open it, but I want to make sure everybody gets it. So I don't want to do it on a monthly basis because I don't think that's, you know what I mean? But quarterly, I want to keep, this is very important. And I appreciate all your time here, both of you tonight. Thank you very much. But as a body here, we want to keep this in front of us. I don't want this to get swept under the rug. So if we continually communicate with you and John's office on this, I think it's best going forward. So, all right, thank you.
I want to thank all of you for your suggestions and your feedback. So thanks for the time to
Thank you, Debbie. Thank you, Patty. Moving on, we have citizens' comments. Any citizens wishing to speak? You'll have 5 minutes. Please state your name and address for the record. Any citizens' comments? Citizens' comments? Seeing none, citizens' comments are closed. Announcements of the chair. I have one. On your desk tonight, there was an envelope. Inside that envelope, they have 2 passes to Boundless Adventure Aerial Park for each supervisor. As a member of the county board, you are some of the biggest ambassadors for Kenosha County. With these, you will get a chance to experience the new exciting attraction made possible by our private-public partnership designed to bring attention to one of our wonderful parks, and then tell your friends, family, and constituents they should go. Along with the passes is an instruction sheet for you to redeem them. I hope that all supervisors take the opportunity to experience the Boundless Adventures for themselves and get the word out to all the constituents in Kenosha County. That's all I have. Moving on to supervisor reports. Supervisor Franco, you have the floor.
Yes, thank you, Mr. Chairman. I just wanted to concur. I was able to attend the Boundless Adventure ribbon cutting this afternoon and at Bristol Park, Pringle Center, and I was quite impressed with the layout. The course is really well built, and it seems to be in harmony with the surrounding environment. I wasn't able to do the course this afternoon, though I saw many people who did, and they seemed to be having a good time, including some of our supervisors. And I think it's just a great addition to the county park system, and I highly recommend county residents to attend and enjoy themselves, as well as supervisors. I think you will enjoy it. That's all I have to say.
Thank you, Supervisor Franco. Supervisor Uhas, you have the floor.
I was also going to report on the ribbon cutting and dedication today out at Bristol Woods. It was very well attended. I saw Supervisor Poole and Supervisor Decker, as well as myself, trying out the courses. They have a very unique system as far as safety goes with these courses, and to see the children interacting with their families out there was quite impressive. And another thing I saw was after they were done with the courses, they were taking time to go into the Pringle Nature Center, which is a hidden gem that we have out there, which a lot of people don't even know exists. So I'm hoping with this course, when people go out to the Boundless Adventures, they're going to take advantage of the paths and what Bristol Woods has to offer, not to mention what's going on at the Pringle Nature Center. And then also I wanted to talk just briefly on Saturday, May 18th, I had an opportunity to join Deputy Koluka for a second shift ride-along. I was very impressed with his courteous, professional, and extremely diligent work. Sometimes it's far too easy to forget to say thank you to those who have made their life to help those in need. We always hear, well, it's your job. We think if that makes it less worthy of a thank you. So I'd like to take this time to say thank you. Thank you for all you do. Thank you for your service. Thank you for your attitude. Thank you for all the hours you give. We realize that sometimes a job doesn't stop when you go home, and so we always say thank you to your families for what they have given to our community through you. I would like to commend the Kenosha County Sheriff's Department for their excellent training and for the kindness that was shown to me during my second shift ride-along with Deputy Kolaluka. On May 7th, County Executive Cruiser said during the State of the County, we need to support our deputies with good equipment and vehicles, and we have, but it doesn't end there. We need to keep up with salary and benefits to be competitive as our county grows and becomes even busier. Cruiser said the county will need to do a catch-up and address what we pay deputies in the 2020 budget in order to improve retention. I wholeheartedly agree with County Executive Cruiser with respect to salary and benefits for our deputies. I've seen firsthand the tremendous dedicated and professional staff of our Sheriff's Department. We must take action on ensuring that not only we support our law enforcement with our sentiments and kind words, but also with our physical resources. Thank you.
Thank you, Supervisor Uhas. Supervisor Rodriguez, you have the floor.
Thank you, Mr. Chair. Just briefly, I had a chance to open the envelope and read that. I do have a question through you to Corp Counsel. Are we allowed to accept these as elected officials?
Yes.
Okay, that was that. And then moving on, Kenosha County, not so much my district and not so much many of our districts, but to the rural supervisors and the residents living in those rural districts, they're having a really tough flooding issue right now. And though I don't personally represent those individuals, it affects those who live in my district, and I think in all of our districts. You know, we continue to improve roads in Kenosha County, and that's a great thing, but I think we need to take a really hard look at when we resurface a road or we raise the road or what have you, where's the water going? Because this is the livelihoods of so many people out in the rural parts of the county. And as of 4 days, or today's the fourth day, their crop insurance from the federal government has gone down one day every time, or every day they don't. It's gone down 1% every day they don't get their crops in the field. And this isn't insurance that's paying out the market rate for what they're growing. This is insurance that's paying out for the cost of their seed. And at the end of the year, if they got back the cost of their seed, they broke even. And I don't think any of us can afford to live merely by breaking even. So I think that's something that needs to be addressed. Hopefully, that's something that our county executive has taken a hard look at and will be addressed in this, this upcoming budget. And then I may get stopped for this next point because I don't know if it can go in supervisor reports, but I do have a question. I was under the impression that there was not going to be any zip lines at Boundless Adventures, and I had a chance to speak with a few members of Public Works, and they said that that was the impression too. I don't have an issue with there being zip lines. I have an issue with us being told one thing and then something else happening.
Well, I guess I don't know either. And it's not a supervisor report, so the best I could tell you is contact the county executive's office.
Okay. Thank you, Mr. Chair.
Thank you. Seeing no other supervisor reports, we'll move on. County clerk.
Old business, policy resolution, second reading to required. Policy resolution to approve the technology use policy. Rose, yes. Ron Frederick, yes. Gable, excused. Wambolt, excused. O'Day, yes. Kubicki, yes. Gens, yes.
Supervisor Rose, you have the floor.
Thank you. I would move the resolution on behalf of the Finance Administration Committee.
Thank you, Supervisor Rose. I have a motion by Supervisor Rose, second by Supervisor Ron Frederick. Supervisor Rose.
Thank you. This is a update of a previous policy adopted by the board called the Electronic Communications Policy. It was last updated in 2011. This particular update has to do strictly with the scope of the policy. It is aimed at including all users of county technology, just not the employees, but also contractors, vendors, or anyone else that connects to or uses county technology services. The committee has approved of this, and we ask for the approval this evening.
Thank you, Supervisor Rose. Seeing no discussion, all those in favor say aye.
Aye.
Any opposed? Resolution passes.
Resolution 2, policy resolution to approve the identity and access management policy. Rose, yes. Gable, Ron Frederick, yes. Gable, excused. Wambolt, excused. Gens, yes. Kubicki, yes. O'Day, yes.
Thank you, Supervisor Rose. You have the floor.
I would move the policy resolution.
Thank you. I have a motion by Supervisor Rose and a second by Supervisor Gens. Supervisor Rose.
This is formalizing in writing a recognition of existing policies that have been implemented by the Information Technology Department. In particular, it's a security policy that creates some guidance based on industry-wide best practices and county needs and how to manage access to our services. In the words of the director, it defines password complexity when accounts are deleted and also addresses many of the frequent requests in future audits. We ask for your approval this evening.
Thank you, Supervisor Rose. Seeing no discussion on this, all those in favor say aye.
Aye.
Any opposed? Resolution passes.
New business, Resolution 11, from Supervisors Aaron Decker, Amy Mauer, Monica Uhas, and the Legislative Committee, a resolution celebrating the 100th anniversary of Wisconsin ratifying the 19th Amendment to the United States Constitution. From the Legislative Committee, Nudo, yes. Berg, yes. Boyd Frederick, yes. Franco, yes. Nordigan, yes. Geschke, yes. And Mauer, yes.
Thank you, Supervisor Nudo. You have the floor.
Move resolution 11.
Thank you. I have a motion by Supervisor Nudo and a second by Supervisor Berg. Supervisor Nudo.
At this time, I would like to have Supervisor Decker speak on the resolution.
That's fine. Supervisor Decker, you have the floor.
Thank you. June 10th, 2019 is the 100th anniversary of Wisconsin being the first state to ratify the 19th Amendment, allowing women the right to vote. I want to share a little more information about the suffrage movement in Wisconsin. Wisconsin raced with Illinois and Michigan to be the first state to ratify the 19th Amendment. Former State Senator David James was appointed as special messenger to transfer the certification to Washington, D.C. He hand-delivered the certification moments before the Illinois messenger. While Wisconsin is the first state to file the certification, other states soon followed, and when the necessary 36 states ratified the 19th Amendment, half the U.S. population was enfranchised on August 26, 1920. The fight for women's suffrage in Wisconsin lasted 72 years from the first Women's Right Convention to enfranchisement. Thousands of women advocated for the right to vote on the streets, in newspapers, and in the state and federal capitals. Wisconsin-born Carrie Chapman Catt led the national movement, meeting with President Woodrow Wilson to secure his support for suffrage in light of women's contributions during World War I. Wisconsin women, like former First Lady Belle Cass La Follette and Reverend Olympia Brown, garnered national attention for their suffrage efforts. Most of the women who began asking for the right to vote never lived to see the enfranchisement of women. But the daughters, granddaughters, and great-granddaughters of the women who fought so hard to vote have been making their voices heard at the polls for nearly 100 years.
Thank you, Supervisor Decker. I want to publicly commend Supervisor Decker, Mauer, and Uhas for this resolution. Seeing no discussion on it, all those in favor say aye. Aye. Any opposed? Resolution passes.
Communications, 11, communication from the Finance and Administration Committee regarding resolution authorizing transfer of 7 parcels taken by tax deed to the City of Kenosha and forgiveness of taxes.
Refer to the Finance Administration Committee.
12, communication from the Judiciary and Law Enforcement Committee regarding resolution cabaret license, Stein Farms.
Refer to Judiciary and Law Committee.
Claims, Timothy Dotson, vehicle damage and personal injury.
Refer to Corporation Council.
Sunny Chung, personal injury and vehicle damage.
Refer to Corporation Council.
Approval of the May 21st, 2019 minutes by Supervisor Rodriguez.
Supervisor Rodriguez, you have the floor.
I move the May 21st, 2019 minutes.
Thank you. I have a motion by Supervisor Rodriguez and a second by Supervisor Uhas. All those in favor say aye.
Aye.
Any opposed? I have a motion to adjourn.
Motion to adjourn.
I have a motion by Supervisor Uhas, a second by Supervisor Rodriguez. All those in favor say aye.
Aye.
We're adjourned. Thank you and have a nice evening.